Wisconsin's Republican governor wants to make his state the first in the nation to require many recipients of some forms of public assistance, such as Medicaid and food stamps, to take drug tests. The reaction by some has been fierce. Senior correspondent Mike Tobin has that story from Madison.
Rosetta Pettinger is a beneficiary of public-assisted health care. She is not a fan of submitting to a drug test, believing that the results could be used against her.
All type of things could come about from you revealing that information, which I think should be a choice to reveal.
Governor Scott Walker says Wisconsin is hiring. Most jobs require a drug test. The idea is to get people to pass at the public assistance level, off their drug addiction, as well as their addiction to public money.
But I think most of us believe that public assistance should be more like a trampoline than like a hammock. And really, for those who are able to work, we should enable them to get back in the workforce.
Called Badger Care in Wisconsin, 1.2 million people receive a public health benefit. The drug testing requirement would apply only to those without children, estimated at 148,000 people. Opponents say if the idea is to discourage poor people from using drugs, it will fail. It will discourage them from seeking medical help.
Drugs can come very cheap, and you know, when you're poor and you're going through a lot of things in life, sadly, we want to kind of drown that feeling. We want to numb it.
Opponents in the state legislature and public assistance advocates say the testing would divert money from treatment. The proposal targets the poor and villainizes drug addicts.
We think this would be a big step backwards because it approaches drug addiction as a moral failing rather than as a disease.
However, a key element in Walker's proposal: if someone tests positive, they get treatment for drug addiction on the public dime. Only the people who refuse the drug test lose the public health benefit.
We treat it like a health issue. We say we know that that person, if given the help they need to get back up on their feet again, to get healthy again, to get clean of their addiction, we know they can work.
The measure needs to be approved by the Trump administration. It will be sent to Washington early next week. It still needs to be approved by the Wisconsin legislature as part of the overall state budget, and a court challenge is anticipated. James?
Our Mike Tobin reporting.